as we spoke about surgery, you need to know the purpose of these stations. Medical error. What is the percentage of having a medical error in the exam? 100%. You cannot have an exam without medical error. So I will give you the medical error stations in like 45 minutes, revision, or a quick recap. It's not actually a quick recap, it is a proper recap, but in a quick way without interruption, yeah? So in the exam, you must have a case of medical error. And as I discussed in surgery, how much should I speak in medical error? How much history should I take in medical error station? Okay, first of all, what is medical error station? So this branch is medical error. What is medical error stations? And our main problems in medical errors is how much history. Again, how much? History. People will abuse history. You take too much history and then, you know, if you take too much history, you're not going to be able to manage and have two-way consultation management. Okay? So a medical error stations is a scenario where there is an error that you have done, you have made a mistake, or your colleague have made a mistake, and you are talking to the parents or to the patient himself. So there are certain steps you will follow in every single station. Medical error station, at the door you will know an error has happened. But what is the structure? Forget about scripts. What is the structure? For any medical error station at the door, what should I know? In medical error station, there is a principle. There is principle. Before I discuss the structure, be honest. What is the principle? What is the principle? Be honest. If you don't be honest in medical errors, you will 100% fail because it's an ethical thing. What do I mean by be honest? A mistake has happened? Yes. Who made it? It's written in the question that you made it, or somebody else say, we have made a mistake. Yes, there is a medical error has happened. Don't say, well, to be, you know, no. Straightforward. So be honest. When there is a medical error station, always tell yourself, throughout the whole station, I will be honest. Okay? So, what are the steps I will follow in a medical error station to have a good, effective station? Introduce yourself. I'm Dr. Fatih Helbab, one of the general doctors here. Can you please confirm your full name and date of birth if you are talking to the patient? What if the error has happened with his son? So can you please confirm your full name and then the son's full name and date of birth? Do not ask the father date of birth because you don't need the father's date of birth, yeah? You need the son's date of birth. After confirming identity, what is step one in a medical error kind of stations? What is the first step in medical error station after I have confirmed the identity?
Assess the knowledge.
Assess knowledge is good, which we have said in the old course. Assess knowledge. But I will add a small modification here. Step one, before assessing knowledge, I will add a small modification, which is, for example, you are coming to me in the clinic and I will be telling you a medical error. Today, you brought your son, X-ray was done, and then you went to home. I checked it and I said to you, X-ray is normal. Then you went to home. Then they called you, come because we want to speak to you. We want to speak to you. As far as you are concerned, everything goes normal. So when you come to me, if I start by assessing your knowledge, which is, how much do you know about your son's condition? Well, I will feel it's strange question. Doctor, as far as I'm concerned, my son is normal, he's okay, you send me home. And today you are asking me again how much. Is it normal to bring the patient or the relative same day to the hospital? So before you assess knowledge, I will put a step. Step one is not assessing knowledge, it's natural step. Well, I'm Dr. Fatih Helbab, one of the doctors who saw your son today and examined him and sent you home. This is the introduction. Okay? And I'm here to discuss about your son's condition or Adam's condition. Don't say the word son, use the child name as a sort of rapport. And I'm here to discuss about Adam's condition. But before we go further, is it all right if we have a chat about how much you know about his condition? Then you go into assessing knowledge step 2. So step 1 here is basically telling him about the setting of what's going to happen. Why you are here. You are here to discuss about Adam's health and about what happened, and you are one of the doctors who saw him today in the morning. So you are telling him, I know I've seen him in the morning. I am one of the doctors who saw him and examined him and sent you home. But I'm here to discuss about his condition. Before we move further, then can you tell me how much you know about his condition? So basically, it's like an introduction of what will be involved in the consultation, rather than jumping into assess knowledge. And for him, doctor is not really normal to try to take history now when I was here in the morning. Do you understand the first point? Do you understand or not?
Yeah.
So what is the first step at any consultation, guys? Because lab 2 is about performance. And doctor, what's your name?
Isra.
Dr. Isra, imagine if you came with your son in the morning, I've examined him, checked the x-ray, I said to you it's normal, you can go home. Then later on they called you to come. I'm talking about real life situation. Then you came and they asked you, hi Isra, I'm Dr. Fatih Al-Bab, can you please tell me how much you know about your son's condition? What would you say? Doctor, why are you bringing me here anyway? I've gone home and you said everything. Why you bring him? What do you mean? So you want to know why we have in this consultation? The reason why. Does that make sense? So always tell the reason why. So the first step is the reason why you are having this consultation as an opening. And I am one of the doctors who saw your son today, or if it was not you, say I'm one of the doctors in the team looking after Adam. I know you brought him this morning and we've sent you home. I'm here to discuss about Adam's condition, but is it okay to have a chat and tell me how much you know about his condition before we move further? Now she knows that, yes, he knows. Yes, he knows I'm here. Yes, he knows I was here. Yes, he knows about his condition and he wants to tell me something, but before that, he wants to know how much. But if you start right away by how much do you know, she will tell you, are you confused? Brother, you sent me home today. What's going on? Why you want to know? Because I've gone home. So this is the first thing, is the reason why you are here, or the induction or the introduction for the station. Step 2 will be assessing knowledge, which is, before we move further, can you please tell me how much do you know about Adam's condition, or how much do you know about what we have done to Adam? So assess knowledge, yeah? So step 2 is assessing knowledge. Assessing knowledge of who? Of the father, and him knowing how much about the son's condition. What is step 3? I assessed his knowledge. He told me, yes, I brought him today. He was fine. He was fine. X-ray was done and you told me he's normal. Go home, doctor. You understand? So step 3, after assessing knowledge, what do you think? Step 3. I assessed his knowledge.
Assist the son.
No. Step 3, yeah, it's assessing harm. Step 3 is, how is your son? How is he now? How is he now? How is he doing? Is he in pain? So step 3 is the harm. And be careful, because when you assess the harm related to the condition. What do you mean? If it's a foreign body mist and it's in the gut, so always, what will the foreign body do in the gut? Maybe vomiting, maybe constipation, maybe pain. If it's in the windpipe, maybe drooling saliva, maybe shortness of breath, he can't breathe. So when you assess the harm, only assess it due to or related to the condition. What if missed the hairline fracture
Is he able to?
in the arm? Is he able to use his hand Is he able to move it? Can he hold things? What if it's a missed hairline fracture in the leg? Is he able to walk? So please, when you assess harm, assess it to the problem where the mistake happened. Assess harm. What if the child was given antibiotic by mistake that he's allergic to? Any rashes? Shortness of breath? Swollen eyes, swollen tongue, swollen, face. So please do not go into too much irrelevant. I will assess the harm of where the problem happened. Clear? Step 4. What is step 4? Step 4, after you assess the harm, you know that there's a... Now, details about the error. Details. When I say details, I mean be honest. Details or inform in details about what? Guys, be honest. Please. Have you made a mistake? Yes, be honest about it. Say, this is the mistake. I forgot this. I forgot that I gave him I did not ask about. So honest. Inform me the details of the error. Don't just say, well, we've given him medication by mistake. No. I'm the one who looked after him. I'm the one who gave him medication when he had allergy, and I did not ask him about in details. Because Dr. Muba, what I'm gonna say is gonna be something not good. Should I say it in details? You should be so honest. Inform the error in details and be honest about it. After informing about the error, what should come? Apology. I apologize about the error. Then next step, managing or rectifying. Rectifying is solving the problem. So management or rectifying the mistake. So managing or rectifying the mistake, and always when you manage or rectify the mistake, always there are steps which are further examination, further management, which means further scans. If it's a foreign body mist, if it's a hairline, further scan. So always it's gonna be everything from scratch. Further examination, further investigation, and what you will do. Medication will be given or procedure will be done. So in the rectify or the management, I will say further what? Examine, and further investigation and treatment. And treatment here include procedure or medication, depending. So always make sure you examine. Why? If I made a mistake, if there's a medical error here, do you examine the child again? Yes. Okay. A mistake has been made, for example, missed hairline fracture. Do you want to repeat the X-ray?
Yes.
And then the treatment. So 3 steps: further examination, further investigation, and management. You will do. Management you will
do.
Medication you will give. Procedure you will do. And now the final step after management, I will call it, and I made it final step, which is the step where you read in scripts. Paperwork. I will write it as paperwork. As what? Paperwork. The paperwork. What is the paperwork? Paperwork, which is incident form, will be written. If the patient wants to complain, offering, complaint department, pulse, patient, advisory, liaison services, and root cause analysis meeting. It's a meeting where they meet and they analyze the problem and they find the reason and they try to prevent it from happening. So how many things paperwork? 3. So paperwork is incident form, and pulse, which is patient, advisory, liaison services, which is the complaint department, and finally is root cause analysis meeting. From the term meeting, where root cause, the reason why this problem happened, and try to prevent. However, the complaint, do you offer it to every patient?
No.
Do you offer complaint to anyone?
No.
if they wanna complain. Do not say, Jana complain. If they mention it in the station, yes, we can help you with that. If they did not mention anything about the complaint, don't offer. Don't say, Jana complain. Don't. Please don't. Okay? So, any medical error station. What is the meaning of medical error station? Problem happened. And your job is to tell and manage. Step 1 is the reason why you are having this consultation. Is step 1 is not assessing knowledge. It's not how much do you know about yourself. Brother, are you okay? Why did you bring me here today? You've sent me home. Why? What do you mean how much? No, it's the reason. It's the opening, breaking the ice. Well, I'm Dr. Fatih Albab, one of the junior doctors here. I'm the one who saw your son or Adam today. Yes, I'm the one who sent you home. Well, I'm here to discuss about Adam condition, but is it okay if I know how much you know about Adam before I go further? Yes, doctor. Can you please tell me how much you know about Adam? She will tell you. I brought him, you did x-ray, you send me home. This, that. Then assess harm. And I said assess harm, talk about the system. Talk about that.
System.
All differential one, do you go? No. System. Foreign body mist. So talk about shortness of breath, vomiting, constipation, okay? Hairline fracture that you missed. A fracture you missed and you send him home. How is the mobility? How is the pain? Is he in pain? Is he able to use her hand? You know? So always system. Then tell them what happened in details or honest or hide and cover. Honest. Right away after you tell the error, you must offer an apology and always say to move further. Let me tell you what we're gonna do. What are you gonna do? Further examination. Further investigation on whatever system, X-ray, whatever. And step 3 is what you're gonna give as a treatment or procedure. And finally, what is the final step? And the paperwork is what the scripts focus on. We're gonna do this and root cause. No, I don't care about the root cause analysis meeting because I have been working in the NHS. I've never seen it once. And if any one of you has a friend or a partner who works for the NHS, I've never done it once. For example, if I give a patient by mistake a medication that he has allergy to, do you think we're gonna gather the whole hospital, bring everyone today? There is a patient who, no, you understand? And we have a meeting and what happened, what is the reason, who took the history? No. So the root cause analysis meeting, you might not even talk about it. The complaint, do you offer complaint?
No.
If they ask for it, unless you hate your colleague. If you don't like your colleague, if you hate your colleague, then you can say,
You offer, you take it.
complain. If I was you, I'll complain. You know, I can understand. Then, if you hate your colleague, that's the only indication. If you don't like your colleague who made the mistake, you can then tell them, make a complaint. And instant form for everyone. Any problem, instant form, yeah? So, in these stations, I would like to tell you, it's more about talking. It's more about how you talk. It's all about how you maintain a good consultation. The patient will be angry or happy? Angry. When you open the door, the patient is angry. I can see you are not happy. I can see you are upset. Don't say I can see you are angry. No. Then I'm here to help you. Then I'm here because some of them, they will be informed over the phone. And you come and they know about there's a problem. So always try to calm them down. I can see you're upset. I'm here to help you. I'm caring about your son. Let's move further. One thing you shouldn't forget in these cases. What? One thing you shouldn't forget is the senior. Because you made the mistake. You made the mistake. Or your colleague or the juniors. Yeah? So I will further examine him. Yeah, brother, you examined him before. I will further investigate. Yeah, brother, you forgot. You missed the investigation. So always say I'll talk to my senior because he will have a further look because you made the mistake. And if I am the father and you made a mistake with my son, do you think I'll be happy to see him again? Do you think I'll be happy to you? What is the point? So always you have to hear, make sure they are reassured by I will talk to my senior. He will be here observing, looking, examining. Yeah? Okay. I will tell you a trick. What if the patient, whenever you start the consultation, said to you, I want to talk to your consultant. I don't want to talk to you. You are a junior doctor. What is your answer? Definitely you can talk to my consultant. Definitely. It's all right if we have a chat, and definitely I'll bring him and you can talk to him. Can you talk to the consultant if you are a patient? Of course. Do you need a permission? No. In the hospital you can talk to the consultant if you want. Because some doctors, you know, can we talk, and some doctors, well, he's busy at the moment. I'm serious. Well, he doesn't have time. I get these answers, by the way. I'm not just saying it, but when I do mocks, I get these answers. Well, I'm sorry, but he's not available at the moment. No, he is available. Yes, definitely we can help you there. Definitely you can bring him, but is it okay? You can have a chat then. He can come, you know. So, first station. Just write down the scenarios of the medical errors if you want, just the question, the stem, if you know them, that's it, okay? First station, you are an FY2 doctor in the A&E. Be careful, because maybe you are the one who saw the patient, and maybe you are not the one. Maybe it's your colleague, yeah? Okay, one principle here in medical errors. Doctor, what's your name?
Caroline.
Dr. Caroline. One principle in medical error, you cannot blame anybody. You cannot blame the patient and say, well, you know, it's your fault, because you cannot blame, you cannot give an excuse. You cannot give an excuse by saying, well, I'm a junior doctor. If you are a junior doctor and you are not competent enough, why are you here? So you cannot say to him, I am. Think about it. You can rephrase it, but not in the phrase, well, I'm sorry, I'm a junior doctor and I cannot read X-ray and I will go and learn and have courses. No. Just think about it. If you cannot read X-ray, why would he put you here to read my X-ray? You understand? So you can put it in another phrase. So it's all about counseling, is all about
How do you speak?
how you talk, how you say the thing, how you say the phrase. The way you say it. So, well, I can see that it's not acceptable. I can see that there is no reason why this should have happened. However, as I'm not that much experienced in reading X-rays, I will go and have, you know, not, I'm sorry, I'm a junior doctor. Oh, dear client, where should I take this? Sorry, what do you mean? I'm sorry, I'm a junior doctor. I'm sorry, I cannot read X-rays and I will go on courses. Why didn't you go on courses from before? You understand? So always don't give an excuse for a mistake that has happened. And always say, well, there is no excuse for what happened, however. Okay? So the first station, you are an F1 doctor in the A&E. 2 years old child was brought by his mom because of swallowing of a foreign body. You examined the child, you have done X-ray, and you thought it's normal. The child went home. Later, the specialist radiologist found that there is a missed foreign body in the esophagus. Where?
Esophagus.
Where? Esophagus. And you've been asked to talk to the mother. So who saw the child? You, not the colleague. You send him home, you said X-ray is normal. What is the foreign body? Esophagus. The GMC, they always change. I mean, we don't fix, we do not fix things, and we are not here to be scripted. Dr. Caroline, they made one change, for example.
In the stomach.
It's in the, no, it's in the lungs. If the foreign body in the esophagus, can it pass on its own?
Yes.
Can or not?
Can.
Yes?
Yes, can.
I'm just having a discussion with you to show you how you can get 0, 0, 0. And you come out and everything goes fine. Beautiful station. Beautiful, because you are so onto the esophagus, and then you go to the exam and we take esophagus and we put lungs. Then in the mock, well, it will go on its own, it may go on its own, brother, in the lungs, how will it go on its own? So be careful from words. So if the foreign body is in the esophagus, it's not if it's in the lung. If it's in the esophagus, what are the symptoms that you will focus on? Esophagus. So vomiting, constipation, nothing to pass. Have you fed him? Is he feeding well? And you can say the foreign body can pass on? Can. But if it's in the lungs, what are the symptoms? Choking, shortness of breath, drooling, saliva, not able to breathe. And in management, can you say it can pass on its own?
Emergency.
Pass whereby you can make hole in the lung? No. So my point is, be careful from esophagus or lung. Where is the foreign body? Anyway, so let's start the station. First step is opening the consultation. I'm Dr. Fath Al-Bab, one of the general doctors here. Can you please confirm your full name? Can you please confirm the son's full name and his date of birth? Open the consultation. Don't go into how much do you know about. No. Open the consultation. Open the consultation. Step one is the reason for the visit, or open the consultation. I am one of the doctors who saw Adam today. I'm the one who sent him home and told you that the X-ray is normal. I'm here to further check on Adam, but is it okay if we have a chat, and is it okay if you tell me how much what? Assessment knowledge. How much you know about his condition before I go further? Yes, doctor. I brought him today. He took he ingested the bottom, okay? And I brought him and they said everything is normal. That's how much she knows. No. Yes, that's right. I've sent you home and everything is normal. How is he doing now? What is that? Assessing harm, yeah? How is he doing now? How is Adam now? How is he doing now? Where is he? Is he active and playful? Did you feed him? Because it's esophagus, yeah? Did you feed him? Did he vomit? Did he pass the stool? Did you find anything in the stool in terms of the foreign body? Okay? Apart from that, any shortness of breath, yes, I will do ask about the other symptoms quick. But my main concern is that GIT. Is he breathing well? Is he active and playful? Is he okay? Yes, doctor. Everything is yes. Well, I'm here to tell you I'm really sorry that I am the doctor who saw him and I did send you home. I'm being what now? Honest. And when I read the X-ray, I told you the X-ray is free, even though there was a foreign body that I missed. And the radiologist has seen the X-ray and he asked me to bring you back and talk to you that yes, there was a foreign body there, and I'm really sorry about what happened. I know there is no excuse for that, but please accept my apology and stop. Let her, don't just like, would you like me to tell you how, no, let her express the anger, give her some time, you understand? Then you apologized or not? Yes, now she'll be angry, always leave her. When someone is angry, don't just cut, let them, okay? Yes, there's no excuse. Well, I'm really sorry. You know, while she's on, let her express her anger. I can see you are upset. If I was you, I would be the same. And you know, then now my main concern is what?
Adam.
Is Adam. I want to make sure that Adam is okay. So now I will be talking to my senior, because we need further to examine Adam. We need to make sure that everything is okay. Listen to the chest, examine his abdomen. What is this? Chest. Examine the abdomen, yeah? And we'll run further investigations if that's all right with you. What will you do? We'll do further X-ray to check where the foreign body, the location of the foreign body. Step 3, I said treatment, medication or procedure. So depending on the position, either we will wait and see because it may pass on its own, or if it's still stuck in the esophagus, depending on the position. And always ask about the foreign body. Always ask about, what do you mean ask about the foreign body? What do I mean by that?
Did you notice that something missing?
What type of foreign body? What was missing, bottom or battery? Because battery is toxic, yeah? And if it's a battery, you're gonna wait and see?
No.
So that's why I always ask about what? The type of foreign body. So, what is the last step? What is the last step? Last step is the paperwork, which you all consider as first step. Root cause analysis meeting, go instant form, and we don't really focus much on the child safety, the child themselves, but we focus more on what will we do instant form, and we're gonna write and do because I would like wait to do a pulse. No. This is come later on at the end when you know that the child is safe. So how many stations we discussed the foreign body now? 2. One of them is in the esophagus. One of them will be in the lung. If it's in the lung, do you wanna wait and see?
No.
No, if it's in the lung,
Need to bring him to the hospital.
they will be in the hospital. So, camera test,
Yes.
specialist who will take the foreign body. That's the only difference. The second difference, if it's in the lung, focus on the respiratory symptoms. If it's in the lung, what would you examine? Chest, auscultation, listen to the chest. Yeah? That's if it's in the lung. You will focus more on shortness of breath, can't breathe, drooling saliva, you know? Okay? And it's more urgent than the esophagus. You can wait if it's in food bile. Okay? Next station. Very common. 8 years old child. So the first scenario, how many stations? 2. Look at the second scenario, 2 stations. We change, little change. And then everybody like, small change, mine will fail, 1 will pass. Look at the second scenario, and I will give you 2 stations for it, yeah? The second scenario, 8 years old child was giving amoxicillin. Was giving
Amoxicillin.
after having a chest infection last night.
Okay.
He developed rash. His mother is concerned. She wants to speak to one of the doctors. Why? Because her son is allergic to amoxicillin, and she told the doctors few times, and he still was given the antibiotics. So in this case, does he have rash? Let's discuss them before we go into the station.
Yeah.
Does he have rash?
Yes.
Do you wanna take history about the rash?
Yes.
Yes, she's saying to you it's antibiotic allergy, but as a doctor you need to
Maybe
check
another
maybe it's
thing.
meningitis. Why was he given the antibiotic? Chest infection. Do you want to check on his chest, like in terms of how is he breathing, how is his breathing, chest problem that he's having. So in this case, he was given what? Antibiotics. Do you want to know how much? Do you want to know how much, like how many tablets he was given? Is it just last night and this morning and afternoon, or just last night, 2 tablets, 1 tablet, yeah? This is my history, which is assessing what? Okay, and because she is telling you that it's rash, do you want to check that it's not anaphylaxis? Yeah? How is his breathing? Any swollen tongue, swollen face? Because if it is, A&E, right away, stabilize the patient. It's not a kind of, hi, how can I help the rash? Oh my God, how? No. So make sure that you exclude
Anaphylaxis is the beginning.
safety. So in the harm, you must exclude anaphylaxis, swollen tongue, swollen mouth, shortness of breath. Okay? Okay. What about the other scenario? I will still discuss the scenario in details, yeah? But I'm giving you 2 examples. One of them he's got rash. One of them I will exclude meningitis. In this, not only exclude meningitis, but also ask how many tablets. Exclude what? So 2 things to exclude if there's a rash. Meningitis and anaphylaxis. The second scenario,
It's not given.
it's not given. They said
About to give.
it was about to be given. So is there a rash?
No.
Do you want to exclude meningitis? Do you want to exclude the anaphylaxis? There is nothing. It's just counseling. Do you understand me? Because when we changed it, some people said, "Where is the rash? How is the rash?" And the rash is here, and anaphylaxis, no, and there is nothing. But because they always fixing your head that it is that one, it was given. No, it was near miss. They write like this. It was near miss. All was just about to be given. So let's discuss the scenario, because the one that was not given is just counseling. Let's discuss the one that was given and there is rash. The reason? Hi, I'm Dr. Fatih Al-Bab, one of Journal's doctor here. Can you please confirm your full name? Confirm your son's full name and date of birth. She's very angry. When you open the cubicle, she's upset. I can see you are not happy. I can see you're upset. I'm here to help you. Can you please tell me what's happened? Because we'll try our best to make sure everything is okay. Assess knowledge. Doctor, I brought my son today in the hospital. Yeah? Or how much you know? I brought him in the hospital last night. He had a chest infection and he was giving what? Antibiotic. He had allergy to, and he was given antibiotic. You've mentioned to me that he had allergy to and the chest infection. 2 things, yeah? With regard to the allergy, how did you know he had Allergy. Why, doctor, should I ask this question? Yeah, you want to know how did she know? Well, doctor, because 3 years ago he developed some
Rash after
symptoms after he was given that. What symptoms did he have back then?
Explore it.
Why? Why is it important for me to explore the previous incident?
Compare it to this one.
Because she will tell you, doctor, he couldn't breathe and he swollen so you know that this guy might develop, or maybe the one that you have not seen yet, maybe is having. So what type of allergy basically? Guys, what type of? Very important question. What type of allergy does he develop when he's giving amoxicillin? Oh no, just some rash. He just vomits. No, just some diarrhea. So you know now when you are in sensitivity. Now, he developed rash, doctor. Do you want to explore about the rash? What is the rash? How big is the rash? Is it increasing? Apart from the rash, anything else? Like what?
Swollen.
Swollen tongue, swollen mouth, shortness of breath to exclude?
Anaphylaxis.
Apart from the rash, do you think that he's shy from light?
Meningitis. Fever.
Do you think that he's got neck stiffness? Because he's 8 years old. He's not baby where you cannot ask about neck stiffness. He's 8 years old. To exclude meningitis, you are safe. If it's not meningitis, if it's not anaphylaxis, you are
Safe.
safe now. So you assess the harm. So in assessing the harm, what are the two conditions?
Meningitis.
Anaphylaxis, exclude. Then inform about the error. Well, I'm really sorry. Yes, the rash, the description that you give me about the rash is what? A rash due to? From what you've told me? Can you please tell me who did you tell that the child is having allergy to this medication? Who did you tell? Which means nurse, doctor, yeah? Who? You understand? Inform honestly or not honest. That shouldn't happen, or that can happen. That shouldn't have happened. I'm really sorry. That shouldn't have happened. Apology. But now my main concern is Adam. So let's move further by examining him. I'll talk to my senior. We need to further examine the rash and check for any other symptoms. Any further investigation here?
Yes.
What? What?
Amoxicillin.
The only thing that you can do here is checking if he's allergic to anything else. So we're gonna run some tests to check what type of allergies that he has apart from amoxicillin, if he's got any other allergy to anything else. Okay? And also the treatment will stop that
Antibiotic.
and we'll give him.
Another.
But before we give him the other antibiotic, we'll make sure that we do test for this antibiotic to make sure he doesn't have any allergy to. This is the station simply.
Safety netting maybe about.
Sorry?
Safety netting about.
Meningitis, safety thing about anaphylaxis. Yes, you can. Now it's time for the paperwork. Depend on the paperwork. By the way, when I finish, I will pick someone to do a station with me medical error, yeah? Now it's time for the paperwork, which is paperwork. We'll put this in an incident form. Number 1. If she want to complain, you can. Offer her the complaint department. And finally is how to prevent this from happening. How to prevent this from happening again.
To put it in the note.
3 things. How many?
3.
To prevent this from happening again. Very important. How to prevent this from happening. 3 things. What will I do as a doctor? What will she do as a mother? What will the child do as a child? So how many people here? 3 will be involved. How many will be involved in this case? Me, the mother, child. Me, I will update the system. I will make sure I write on the patient notes that he has or she has allergy to. You, please, in the scripts, people do write funny phrases. Don't blame her. Don't say to her, make sure you tell, no. I know there is no excuse for this problem to happen, and I totally understand it is the job of the doctors and the medical team to ask you about. However, we do care about Adam and we don't want him to go through this again. So please make sure you tell the doctors. Do you understand the phrase that I've said? Do you understand how I said it? How I said it? No excuse. It's our job, it's not your job, but please make sure. Not just make sure you tell them. She might say, well, is it my fault? I told them last time. Do I have to say? It's your job to ask. So let me save it. You tell them it's our job. There is no excuse. Please just make sure. What about the child? The child, educate them as they grow up. Tell them what they have. Tell them the allergy that they have, and tell them whenever they are getting any medications to tell that they have allergy to amoxicillin, and you can give them bracelet. Clear? Okay. The other station where there is no rash, where it was near miss, there is no rash, it's just counseling of calming the patient or the mother down, of talking to the mother about, okay, how to prevent this from happening, praising the mother for saying to them don't, okay, and telling her that shouldn't have happened. I will put an incident form and they will make sure that they take proper history because this is not acceptable. Counseling. They put it in order to check the scripted doctors who are used to rash, and yes, 9 out of 10 will talk about rash. When there is no rash, there is no problem, there was nothing given. Next station. $60 old. Yeah, and you know, in the previous station with the allergy, you can always say, and we will emphasize more on the importance of taking a proper history, proper data gathering, because the problem here is in data gathering, allergy, yeah? So next station is 60 years old. John Smith was presented, understand the question, to the hospital 4 weeks ago. How many weeks? 4 weeks ago. He was diagnosed pneumonia 4 weeks ago. For that, he was admitted and he was given antibiotics for 2 weeks. How long?
2 weeks.
2 weeks. Later on, it was found that the X-ray upon which you have given your diagnosis was someone else's X-ray. And the patient was not back then developing pneumonia. And he was treated with antibiotic unnecessarily. Talk to him, address his concerns. Today is 4 weeks later and is coming to the clinic. Okay. Is there a problem here?
Yes.
No, what I mean by problem, does he have any symptoms in terms of,
No, it's fine.
was there any pneumonia?
No.
Was there any pneumonia? Are you sure? The reason why the reason why I am telling you this, and the reason why I'm discussing the station like this, because in the mock, you are very confused. Seriously, in the mock you come and you say, how was your pneumonia? I'm serious. How was your chest infection? I can see that you were treated for a chest infection 4 weeks ago. How did it go? Are you breathing well now? Brother, he did not have pneumonia. He was managed for pneumonia when he didn't. So please don't go there and don't say, how was your pneumonia? How was it managed? You know, and whenever I get told this, I will say, well, doctor, it was a bad experience and the antibiotic helped me a lot. Thank you very much for giving me the antibiotics. You understand? So there was no pneumonia, please. There was nothing. So how would you start the station? Again, the reason. I'm Dr. Fatih Al-Bab, one of the general doctors here. Can you please confirm your full name and date of birth? Full name and date of birth. What is the reason of the consultation? Do you want to say how much you know about your condition? No. Well, the reason why we are having this consultation is to make sure that everything is all right. But before we go further, please, can you please tell me how much you know about what happened with you or how much you know about your condition? He will say to you, well, doctor, I came 4 weeks ago and I was given antibiotics. I had the pneumonia. They told me I have pneumonia and they treated me. That's his
No.
Knowledge, does he know about the error?
No.
What if I make small changes and I tell you, doctor, I've been told that you've given me antibiotic unnecessarily. Does he know now?
Yeah.
So
Yes.
in the exam they change. So now if he knows, do you wanna skip informing about the error? He knows. So right away you'll go into management. Does that make sense? Apology and manage. Are you lost?
No.
So sometimes they make small changes. Our patient, does he know about the problem? No. No. But if he knows, do you wanna tell him about the harm and the error, and or do you wanna go right away to apology?
Apology.
Apology right away. So please be smart in the exam, because it's about how you manage, how you handle. Don't be scripted. If the patient knows about his condition, about the error that happened, do not tell him, but let me tell you now, because it's the step, we have to inform about the error. It's just, no. You don't need to inform because he knows. Anyway, if the patient doesn't know, then you will assess harm. Okay, assess harm in this condition. Now, assess harm in this condition. What is the harm that could happen to this patient? Developing pneumonia?
Side effect.
Developing pneumonia? No, it's the side effect. He was giving antibiotic unnecessarily. So, the harm. Mr. Andrew, you've mentioned to me that you were given antibiotics for 2 weeks. Yes, doctor. Like any medications, antibiotic has some side. Did you develop any side effects like vomiting, like diarrhea, like any rash anywhere in your body? No, doctor. So this is the only harm that you can rule out. But there is a long-term harm, which is maybe he will develop infection and resistance later on. Don't talk about it now. So your harm now is side effect. But please, guys, don't ask it, Dr. Muhammad. Don't ask it like any vomiting. Signpost. What did I signpost? I said like any medications. You've been on antibiotic for 2 weeks, yeah? So did you have this? Did you have that? So he knows you're asking about. Please signpost, guys. He needs to know where are you now, yeah? Inform about the error. Well, Mr. Andrew, well, Mr. Smith, the reason why I'm here now is I'm really sorry to tell you, but not I'm sorry of breaking bad news, cancer. Well, I'm really sorry. No. I'm sorry. I'm moving right away because you don't want him to think of cancer. You don't want him to think of, no, because it's just antibiotic was given. So don't be too much. That's what I'm saying, because it will sound that there's something serious here, yeah? Well, I'm sorry to tell you that you were giving antibiotic by mistake. I said inform the error what? And in detail. When you came 4 weeks ago, okay, the doctor who saw you, he diagnosed you of having a chest infection, depending on an X-ray that was not. It was somebody else's X-ray. So, and they stay for a few seconds for him to be angry. Don't just like, few seconds, 2 seconds, 3 seconds, let him talk. Well, this shouldn't have happened. Please accept my apology. And let's move further, which is management. Yeah? Did I apologize? Yes, I'm sorry, that shouldn't happen. In management, he will tell you, doctor, what's his main concern? But what will happen to me now because you've been giving me antibiotics? That's the management now. Well, it is a very valid concern. Please, guys, speak slowly, speak nicely, reflect on the importance of his concerns. Wallahi, this is Blab 2. Blab 2 is not about how much you know. Blab 2 is about how you handle the station. So, with antibiotics, we have short-term and we have long-term side effect if it was given unnecessarily. So, can you please tell me, were you using the antibiotic as it was prescribed the full course? Yes, for how long? For 2 weeks, doctor. Well, from the history or from the chat that we had, you told me that you did not develop any. Because where did I ask about side effect? Well, I asked about it here. So in the harm, be careful because you asked about. If he did not develop, can you bring it in management? No, I'm gonna bring it that you did not. So in management, it's all about educating the patient. So in management, I would say, from the chat that we had, Well, if antibiotic was given unnecessarily, the problem that the patient will have is short term, which is side effect, but from the chat that we had, he did not develop any, fortunately. However, there is some long-term effect, which is developing resistance and being susceptible to infection later on. So at any time, you have fever, you are not well, you feel not yourself, you can come right away, and then we're gonna do investigation to know the specific antibiotic that should be given when you have an infection. That's it. So what is the harm that can happen here? Short is,
Side effects.
did I mention it to him?
Yes.
Yeah.
Did I tell him that you did not have this? Long is, and by that I said to him, it can be managed through taking blood culture and targeting the specific. It's all about counseling his brain, because he thinks there's a problem here, and you need to actually tell him how to manage it and what is the problem. Finally, treatment. Do you want to give him anything? No. Do you want to give him any antibiotics?
No.
Do you want to give him any medication? Does he have anything? No. Paperwork, instant form, 100%. 100%. If he wants to complain, he can complain. But do you want to offer the complaint department? No. Finally, the root cause analysis meeting of how to prevent this from happening. What was the problem?
Patient
Identity. So we will emphasize on checking the identity before we manage our patient, reading the details and the identity on the scans and matching it all with the patient and asking the patient and confirming his details. Station is finished. So this is station. What is the harm? Long and short term effects of giving the antibiotic. Short term, ask about the short term. Long term, how you manage it by telling the patient that, reassuring the patient that yes, it can happen, but not in all cases. But if you do develop any infection, what can you do about it? Okay. Next station is hairline fracture. Hairline fracture. Okay. 4 years old. Tanya was brought by her father with wrist injury. Was brought with wrist injury. X-ray was done, and the father was told that it's soft tissue injury, and he was sent home. Radiologist noticed that there is a hairline fracture, and he asked you to talk to the father about what happened. Again, you need to open the consultation. Okay, so I'm Dr. Fatla, one of the doctors here. Can you please confirm your full name and date of birth? No, you don't need the date of birth of the father. You need the date of birth of the daughter. Please confirm your daughter's name and date of birth. First, the reason why you are here. Guys, why do I say very important to tell the reason why and open the consultation? Because the parent don't know why you are bringing them. So please don't jump into assess knowledge. So, the reason why we are here is to discuss about your visit today in the morning. You brought Hannah, or you brought whatever his daughter's name today to us. Yes. So it's alright if we have a chat, but before we go further, can you tell me how much you know about what happened? He will tell you. I brought her this, that. She had a fall, and you said to me soft tissue injury. You need the details of the harm. What is the harm here? What happened? Wrist and missed her limb fracture. So please, I said to you, when you checking the harm, focus on the specific. Don't ask her the triple D, dehydration. No. How did she fall, doctor? I was walking with her, she fell. Which hand, doctor? It's the left hand. Okay? Is she still in pain? Yes. Is she using her hand or not? No, doctor, she is in severe pain. From when you brought her in the morning till now, have you noticed any changes in terms of swelling, bruises? Sorry?
Yeah, color.
Yes, in terms of swelling, bruises. You want to know from when she was brought till now, what happened? Then after doing data gathering about the harm, okay, because maybe there is displacement, hairline fracture. If they get missed, what happened after? It's a hairline. After it becomes proper fracture, displace the fracture. So that's why you're assessing here. Then move on to inform about the harm. So inform about the error. So what about the harm here again? What do you want in the harm? Is the hand? Which hand? How severe is the pain? The progression, what happened? The bruises. Is she using her hand from when you brought her till now? Any changes? Now go to inform about the error. Honest or not?
Honest.
I'm the doctor who saw her. If it's written that you are, I've sent you home saying that everything is normal. I've told you that the x-ray is normal. However, my senior read the x-ray and found that there is. Don't say, I'm sorry, I'm a junior doctor. Yeah, he will complain either way. He's just professional. You understand? Well, but why did this happen? I'm sorry, that shouldn't have happened, but this hairline fracture is very small fracture that is not easily to be seen by all doctors. However, this is not an excuse. That should have gone back to my senior. It's not an excuse. Not excuse. Don't. I'm a junior. So what? You're a junior. Why do they brought you here if you cannot do the X-ray? So I'm sorry. Then rectify. How to rectify? Our main concern is making sure that Hannah is all right. So to move further, I will bring my senior because we need to further examine her arm and see if there is any further damage happened. What else in the investigation? Further investigation.
X-ray.
Repeat the X-ray to see the extent of the fracture. Third step, I said treat. Either something you give or a procedure or whatever. So last step is in the management is treatment. What is the treatment?
Apply cast.
Orthopedic. We'll talk to the orthopedic doctor who will come and manage her fracture. You're not gonna apply cast here in the A&E. We do here apply cast. We do here apply cast in A&E, but in this case, just say orthopedic doctor who will come, who will make sure that check the X-ray and make sure that the fracture is managed. So don't say I will apply cast. Okay, orthopedic, and she will be given painkiller. So something you will give painkiller, orthopedic doctor. Paperwork, or write an incident form. What if he does not say I want to complain? Don't. What if he said I want to complain? Definitely we can help you with that. How to prevent this from happening? Well, as I told you, he will tell you how to prevent something. There is no excuse for this to happen again. However, we will try to go back to our senior in such cases to prevent this from happening, and also focusing into some courses for reading X-rays. But better to say senior review. Okay? Next, we've got only 2 left, so not long. Okay, 2 left. Missed renal biopsy sample. Missed renal biopsy sample. By the way, from these 7-8 cases, you're gonna have 1 for sure. Medical error. Missed renal biopsy sample. It is a case of a patient who they suspected to have glomerulonephritis, kidney problem. Biopsy was taken. Today he's coming. The biopsy sample is missed, and you've been asked to speak to the patient. Reason for the visit or reason for the consultation. I can see from my note. So the question is, 21 years old, suspected post-streptococcal glomerulonephritis, renal biopsy was taken 2 days ago. The lab did not receive the specimen. Is it clear it's medical error? It's not medicine. It is clear it's medical. The lab did not receive the specimen. So start with opening the consultation. I'm Dr. Faisal Bab, one of the doctors here. Can you please confirm your full name and date of birth? Step 1 is the reason. So the reason why I'm here is to discuss about the sample that have been taken 2 days ago. Don't say anything about the sample yet. But why are you here to discuss about that sample? He might be stupid, like bully patient to say, what is the result, doctor? Tell me about the result. Then, you know, like, there is no result, you know. So, to be smart, don't worry. I'm here to discuss about everything, but let's have a chat
Before
to move. You understand? Because he will say to you, tell me, doctor, what is the result is, you know. Then, how much you know about your condition? He will tell you, I had this, I came that. The procedure. The procedure. How did the procedure go? So now when you ask about the procedure, how did it go? In the assess knowledge, because when you talk about the procedure again, he will have some challenges that you already know about them. You're ready for his answer. How did the previous procedure go? Well, doctor, it was painful. It was painful. I couldn't go to work, whatever the challenge. Because this is challenge, it will be the same challenge this time. And you know that you need to take a biopsy again. He doesn't know yet. So the harm. What is the harm here, guys? So please don't forget to ask about the previous procedure and the challenges, yeah? The harm. What is the harm here? A patient who's missed biopsy, what will be the harm?
So you have to take a biopsy again.
Delayed treatment. No, delayed treatment. Because the reason why I will take the biopsy for definitive,
Diagnosis.
but now it's further days, delayed treatment. So in the harm, try to assess his condition quickly. What symptoms do you have? And from when you had the symptoms till now, were you given any medication or not? How do you feel in yourself? Is it getting worse or getting better? Assessing the condition to see where you are, because it's gonna be Dr. Muhammad delayed treatment. Now, inform about the error. In details or?
Detail.
I'm really sorry. I'm here to tell you that the biopsy that we've taken is messed and stop. He will be angry, he will shout at you. That's why go and let this patient shout at you, and then the consultant will come later, the big man. Why did you miss the biopsy? Why, you know, like, understand? So, please let the patient have his moment of expressing after telling him it's messed. There is no excuse for it. And tell him, guys, what was written in the question. Tell him, the lab has mentioned to us that the sample is not. One thing I've noticed, the guys in the mock, that you don't use what was given here. You didn't? Did you have the mock now, yeah? Yeah. How did it go?
Some good, some were very bad.
Yeah. So tell them that the sample is not received by the lab, and that's why we are here to talk about this. I'm sorry, the sample is not received, and that shouldn't have happened, but our main concern now is taking further sample, which is what? The management. So we should take another sample. So he will tell you, doctor, why don't we wait till you find the sample? Why don't we wait till you find the sample? Why? What is your answer? I'm giving you the concerns. Because what is the management actually? Is further biopsy. That's it. And in the management, not only further biopsy, but in the management is managing his challenges. Because he told you I was in severe pain. So when I say to him, and he told me that you are in severe pain, we'll make sure they are pain free, we'll give you antibiotic, painkiller, or we can even give you what? Local anesthesia, managing the concern. But the actual management is we have to take the sample again. What if he told you, doctor, wait till you find the sample?
We are not sure
We don't want to
Fine.
delay it.
She's very honest. We are not sure if we're gonna find it or not. She is very honest. We are not sure, your brother. So it's a live tissue, yeah? It's what? Live tissue, so it has certain expectancy. We cannot wait till we find it, because we maybe will find it and it cannot be analyzed. What another reason?
Maybe
Delayed diagnosis. We need to manage as soon as possible. So we need to take it, because depending on the biopsy, the management will be. So can you address this concern now? Doctor, I was in severe pain, concern. Painkiller, local anesthesia. Doctor, I couldn't go to work and now I don't have like, you know, that luxury of not going to sick note. So make sure you address his concerns, okay? And I said to you, step 3 is the treatment or the procedure. It's just what's the only management here? Sample again. Yeah? Paperwork. So instant form, and if he wants to complain, he can complain, yeah? Okay, I wanna check the principles in your head about one thing, because that happens all the time in PLAB 2, yeah? Doctor, what if you go to the patient and when you say to him, we need to take the biopsy again, he said no.
Ask why.
Refusal.
When you ask why, he said, the pain, and I don't care about the painkiller you give me, I don't want to have it. Can he not have the procedure? Yes, he can.
Yes.
Assess his mental capacity. Do you know why we do it? We do it to reach that. Do you know what will happen if we don't do it? Yes, doctor, I know. I might not be diagnosed, I might die, but I don't care. I don't care. So he knows the consequences of not having the biopsy, and he knows the benefit of having that,
Yes.
but he still doesn't want it. Guys, it's fine. It's easy choice. Because that's what we do all the time in PLAB 2. We change. We bring you a patient, he's refusing till the end, and they say, oh my God, oh my God, I will fail the station. Why would you fail the station? After the exam, yeah? Why would you fail? Because the patient insisted on refusing. Hey, it's fine. He can refuse. Did you assess his capacity? Yes. Does he have mental? Yes, he has mental capacity. It's fine. So you don't need, your job is not to convince him by force. Okay? We have this every day in the hospital. Any patient is refusing something. Once he's refusing, always mental capacity, assess risk, benefit, he's still refusing, it's fine. Okay, next station. Next station is similar, but blood sample. Missed what? Missed the blood sample. You are an FY2 doctor, 35 years old. Adam was planned for hernia procedure, elective, yeah? His blood sample was taken a week ago, and the sample is missed. Talk to the patient. And usually this station is a phone consultation, which is fine. What is the difference between face-to-face and phone?
Confirm that.
Confirm full name, date of birth, confirm the address. Are you okay to talk now? He is not driving. Start. Okay? When you start talking to him, do you want to tell him the reason or do you want to assess his knowledge? Imagine if you have a call from the hospital out of the blue. I'm just giving you because everybody missed this step. Reason. Imagine if you have a call from the hospital and the patient. I hope you have a good mark. Yes. Imagine if you have a call from the hospital and out of the blue, 2 mistakes we do and we lose marks. 2 mistakes. Number 1, we don't tell our identity first. Guys, IPS communication skills. Can you speak to the patient without telling him your identity first? Can you? No. You don't understand what I mean. I am with you now and I have a call, yeah? I'm due to have hernia operation next week. I had a call. Hello, can you please confirm your full name and date of birth?
Who are you?
Would you confirm your full name and date of birth to anybody?
No.
So please always make this as a habit. Wallah, you are laughing now. But when we do it in the exam, we lose plenty of marks. Make it as a habit. Before you ask the patient to confirm the details,
Tell him.
always tell him who you are and why you are calling him. Look at the difference, and we always make this. People say, doctor, I keep practicing. I did not pass the exam. Oh, it's not about practicing. It's about, are you practicing good or not? So, hello, Dr. Khalid. Hello, I'm the doctor calling, yeah? Can you please confirm your full name and date of birth?
Who are you?
But look at the other way. Hello, I'm Dr. Fathil Bab, one of the doctors from Entry Hospital. I'm calling in regards to your operation that you are going to have with us. So can you please, before we go further, confirm your full name and date of birth? So now he knows who I am.
And why you are calling?
He knows I'm calling. The purpose of the call is discussing the surgery. Now he can give me his details. But before that, he will not give me his details. Unless he's dumb, then he will give the details to anyone over the phone. Like when you walk in the street and someone says, can you show me your ID? He gives you my ID. In Egypt, yes, because you know, if he's even wearing normal clothes and they said, show me your ID, you're gonna have to show him. Otherwise, you understand? But in UK, who you are? Why do you want to see my ID? That's the way of tell the patient first who you are. It's some kind of ethics on the phone and on talking that we may neglect it, but it will impact on the total score at the end. If you do it in 6-phone consultation, you will lose marks. Yeah? So who you are and the reason why you're calling, then you start. Because he knows you are talking about his hernia. Yeah? So before we go further, how much you do know about your condition? Doctor, I have hernia and I'm supposed to come tomorrow for my blood result and going through surgery. That's how much he knows. Well, that's right. That's right. How's the swelling? Have you been vomiting? Any constipation? What am I doing now? Harm for what? Complication of hernia. If it's obstructed, there will be pain, there will be vomiting because there is a bowel contents. If it's obstructed, what's gonna happen? The symptoms I'm asking. So assess harm by asking about complication of hernia. Any pain, any vomiting, any constipation, any changes in the symptoms? No, doctor. Inform about the error right away, early. Error. So the harm is asking about complication of hernia. Inform about the error. Well, I'm really sorry, Andrew. Yes, you told me that you had blood taken last week, but I'm sorry. We have received a call from the lab that they did not receive your sample. Oh, why? This shouldn't have happened. Let him complain, let him shout. I know this shouldn't have happened. We cannot give any excuse for that. But our main concern is what? What is our main concern? Our main concern is moving further to make sure that you will go ahead with the surgery. Because unless we have the blood, we cannot go with that. Please do not forget to mention this phrase. That unless there is blood taken,
You cannot proceed.
we cannot do the surgery. Guys, please do not forget, because that will be the only. Yes?
Do you want to be closing in 5 minutes?
No worries, love. I'm about to finish.
Okay.
Okay? So, unless there is a reason why, unless you tell him that, unless we take the blood, I'm afraid we will not be able to do the surgery. Guys, unless you tell him this, he's not going to be happy. And he's going to keep telling you, no, to go and look for it. So please make sure you use this, Dr. Muhammad, early. To listen, brother, if there is no blood, there is no surgery, okay? You're going to have to wait. So then inform about the details, what happened. I'm sorry, I apologize. Then how to move further. What is the only way to move further?
Do the first,
Take the blood. Take the blood. So what if he said, no, I don't have time? I'm afraid we cannot go ahead with that. Clearly. Are you lying to him?
No.
We cannot go ahead with the surgery, yeah? Then you will go to the further of, he will start giving you concerns. What will be his concern? Doctor, why don't you, I live far away from the hospital. I live far away from the hospital. Can you send him a nurse at home to his house to take the blood? If he's fit and well shaht كده, you cannot. Unless he's bedridden, unless he's, but be careful of what you are offering. You cannot say, oh, okay, we're gonna send you a nurse. No. Okay? You can go to the closest clinic. You can go to the closest GP clinic. They can take the blood there. Okay? But you cannot send him a nurse. Please. You cannot send him a nurse just because he's busy. Imagine if we're gonna send the nurse to everybody. No. You can't. Please be aware of what you are offering. So, nearest GP clinic, nearest talking clinic.
If you just say that I'm in a pain and I can come because
That's something else. But if he said I'm in pain, it's an emergency. Come. You understand? So, you get me? You understand? If it's an emergency then, you understand? So it will not be that case. I'm in pain, why? Because I'm vomiting and I'm... Okay, don't worry. I'll send to the nurse, she'll take the blood and the operation a week later. You understand? So be careful, yeah? So...
Come without the blood.
Yeah, so now you will... What if he said, no, I don't want the blood to be taken? You have directly to tell him, unless we take the blood, there will not be surgery. But offer him nearest clinic, nearest GP, nearest walk-in clinic for the blood to be taken. Okay? What if he kept refusing?
Assist.
Yes. Do you know what the blood will be taken for? To check if you are fit and well to go to surgery. Well, I don't want it. Do you know what will happen if you don't take the blood? There will not be surgery. Well, it's fine. Do you know what will happen if you don't have the surgery? You might have complication. I still, doctor, don't take the blood. It's fine. Okay, there is no problem with that. And I will be documenting this, that we've explained the risks and benefits for you. Okay? Then, instant form. If he wants to complain, he can complain. Offer him the complaint department. But please, there is no national meeting because of the blood. There is nothing like this. Yeah? Because I've been told this plenty of time. National meeting, I don't know where, but 20 doctors in the mock, they have escalated it to the national meeting, a meeting where, wallahi, we're gonna bring the head of the hospital and the head because of missing blood. You understand? Imagine. So please do not. Another doctor in a problem colleague, I was not able to go on time to work to the hospital. That's something else, yeah? But I'm telling you the extent of communication skills. And I was not able to get enough sleep, and I was going to the hospital late because my parents are getting divorced. And she said to me, okay, you can come and stay in my home. You understand? Bear in mind, she's a female doctor. And I am the colleague. So I said to her, oh really? Yeah, you can come and stay in my house, in my room, until they become okay. And then I said, okay. Then by the end of the station, she forgot what she said. By the end of the station, she said, now you will stop working for today and you will go home. I said to her, no, I'm coming to yours. I'm not going home. You understand? So please be careful, because in the mock, that's when I pick the mistakes, that's when I reflect it when I'm given a session. Be careful on the extent of communication. Don't over, huh?
Too much.
Don't over, yeah. You know, and at the same time, if the patient is in pain, you don't need to. I mean, how can I look? I've got, some headache. That's how I'm saying it. I'm really sorry about it. Are you okay? Are you comfortable? Guys, no. Unless the patient is having subarachnoid hemorrhage, meningitis, MI, yes, but if he's coming like, yeah, just I've got some headache for the past 4 months. You don't need to cry for the headache that he's having. You don't need to show him, I'm really sorry about that. That sounded quite distressing, and I will try to give communication skills according to,
Still a complaint.
because it will look so, they will laugh at you. Huh? Yes, they will laugh at you. You understand? Alright guys, that's medical error. Yeah. Now